Morning, friends. At the outset, I would like to welcome you all to this practical diabetology program. And as I'm sure you are aware, this is a program that we are organizing in collaboration with Cleveland Clinic. This program basically is it's a structured module which helps you having better orientation in clinic management of your diabetes patients. I wouldn't say that we are going to teach you on diabetes or educate you on diabetes. I'm sure everybody here is a learned person and everybody is seeing a good number of diabetes patients. So it is not that diabetes is something new to you people and we are going to teach you something very basic about diabetes. But important thing is, despite all this, despite our understanding of diabetes and routine handling of diabetes patients, we end up with small problems in day-to-day practice. And the idea of these sessions is to give you understanding of the basic pathophysiology of diabetes, how does it lead to various clinical situations, and how we intervene into these pathophysiological abnormalities or tricky situations to manage these patients, help them achieve the glycemic targets, the hypertension control, the lipid management, and so on. And at the end of the day, you are able to give a better outcome for diabetes patients. So that's the whole purpose of this program. And to run this program, it's a pleasure to have Dr. Lawrence Kennedy and Dr. Adi Mehta from Cleveland Clinic. I'm sure you know Cleveland Clinic is one of the top-line world-class facilities in United States, Ohio, and it's a huge establishment dedicated to medical care. And Department of Endocrinology there is one of the prestigious departments, and both my fellow colleagues work there as senior faculty. I welcome you, Dr. Kennedy and Dr. Mehta, to India and to this program. And I would request you to join me on the dais. Just to briefly introduce, Dr. Kennedy graduated from medical school at Queen's University, Belfast, where he also did his clinical endocrinology training before coming to United States in 1978, where he worked as a research fellow in endocrinology at University of Florida at Gainesville. His research was in the field of glycation of proteins, hemoglobin, plasma proteins, and collagen, and the relationship with complications of diabetes. After returning to Belfast in 1980, where he was on faculty for Royal Victoria Hospital, the main teaching hospital in Belfast, where he continued his research activities in the field of diabetes, pituitary, and Cushing syndrome. He returned to United States in mid-90s and joined as Chief of Endocrine Division at University of Florida for approximately 10 years, and then he moved to Cleveland Clinic. Dr. Kennedy has more than 100 publications in peer-reviewed journals. He has received a number of awards in UK as well as USA, including the award of Exemplary Teacher for 3 consecutive years from 2005 to 2007 at University of Florida. He currently serves as chair of the Grant Review Committee of American Diabetes Association and is also on editorial board of Diabetes Care. Dr. Lawrence Kennedy is currently the chairman of Endocrinology, Diabetes and Metabolism Department at Cleveland Clinic, Ohio, at United States. Dr. Adi Mehta, I'm sure some of you have heard him earlier because he has been to India for 2 previous Cleveland Clinic programs with us. He completed his medical degree from University of Ontario and did his endocrinology fellowship at McGill University in Montreal, and then joined the faculty of medicine at University of Manitoba in Winnipeg as assistant professor and subsequently as associate professor. And then he moved to US to join as faculty at Cleveland Clinic in Department of Endocrinology. He is a member of numerous societies both in United States and Canada, including the American Association of Clinical Endocrinologists, the Endocrine Society, the American Diabetes Association. He is listed in the Best Doctors of America 2003, 2004, and 2005, 2006. He was also awarded the Outstanding Clinical Endocrinologist Award for the year 2009 by American Association of Clinical Endocrinologists. He has extensive research career, including over 160 scientific presentations, more than 200 publications, and mostly in peer-reviewed journals. His areas of interest include diabetes, thyroid disease, and reproductive physiology. Among his numerous accomplishments, it is his ability to teach at all levels, including clinical, basic science, and research. He is a well-traveled lecturer. In particular, he excels as a role model for residents and fellows. Currently, he is a senior physician at Department of Endocrinology and at Cleveland Clinic. So, welcome you again to this program.